For years I've had problems with both my knees, with no cartilage, and they were bone on bone, And now I'm older, so I decided to get the knee surgery. The first one was the right one. So after the surgery, I came home the same day, and the same day, within 15 minutes, a physical therapist came to the house, and we started right away, working on walking. But he only came that first week because my legs started really swelling up really big and tight. It was like nothing I'd ever seen before. I was so limited and behind schedule with recovery because of the swelling and the tightness, and it was very warm too, so I didn't know what was going on, but I felt something was wrong. And she called the surgeon, and he told me to go to the emergency room right away, and I did. That was the Friday after my surgery. I got to the emergency room, and that's when they found out I had a pulmonary embolism and multiple blood clots in my leg.
Often patients don't even know they have a deep venous thrombosis, which is clot forming in the deep veins of the leg. Sometimes we see a patient who had an acute deep venous thrombosis or an acute DVT that extends, let's say, from the hip veins, thigh veins into the abdomen and pelvic area. That can be dangerous because it can break off and go to the lungs, but also it can cause a lot of leg swelling and difficulty with walking. And if that is not cleaned out, patients can have chronic leg swelling.
I was in the hospital for a while, then I went to rehab at a nursing home. And when I got home, I just thought I need to see a vascular surgeon because my leg was still really huge and still bothering me. And I called the primary, and they referred me to Dr. Noor, which is the best thing that ever happened to me, because I met with her and she explained everything, about the procedure that she would do to make my leg better, to get rid of the blood clots as much as possible and to start me on a better road of recovery. I went to the Vascular Center at Buffalo General Hospital, and everything was so smooth. Everyone was so wonderful to me, and I was nervous. They calmed my fears, soothed my anxiety, and I went for the surgery, the procedure. There were Dr. Noor and other physicians and assistants were in the room, and I was awake, with the mild sedative, and everything they did, they talked me through it and told me what was happening at that time. And it didn't take long at all. So.
Any pain or discomfort?
None. I was like amazed because I was, my anxiety level, I thought it would shoot up. It went straight. I didn't have any anxiety the entire time I was on the table.
We evaluated her with what's called a venogram, which is a minimally invasive procedure. We saw she had some remaining clot in that area, but more importantly, she had extensive narrowing starting and scarring starting in that area. So she underwent a single session, about a 2-hour procedure, where we removed some of the soft clots so it wouldn't break loose, and we actually opened up the narrowing or the stenosis in the iliac vein with a stent.
Within the week, just a few days, my legs started getting smaller, draining fluid, and I lost 12 pounds in a week. And my leg is almost the same size as my left leg now. I can't believe it, I'm wearing clothes, pants that I couldn't fit, like over the past 2 years. I couldn't even see my ankle the past few years because everyone kept telling me that's just lymphedema. They never talked about vascular.
When we saw her back at a month, both her legs were almost completely normal, and she had completely resumed physical therapy and was starting to work on the mobility of her knee, which is why she had the knee surgery in the first place.
It's just been a blessing for her to be, for me to meet her. I think it was the alignment of me meeting her was just positive, and the whole outcome has been positive. So I was going to say thank you, Thank you to Dr. Noor and her staff.